Welcome to the Dr. America Show. I am your host, Dr. Sanjeev Sriram, here on the We Act Radio Network. Thanks for coming back. Thanks for joining us. I hope everybody's spring is off to a good start. So this week's episode, we're going to spend a little bit more time celebrating the Affordable Care Act. And I know that there have been some questions out there about why have we spent so much time this month, this March, on Obamacare. Like, we have done a lot of episodes on Obamacare, and it's a fair question. I mean, we were at the Supreme Court during King versus Burwell. We did 2 whole episodes on that entire Supreme Court case. Last week, we celebrated the Affordable Care Act, and this week, we are doing it again. And the reason why this is so important to me and why I told my producers I wanted to spend so much time on this is because when we look at the Affordable Care Act, this is the most important piece of health policy that this country has produced in the last 40 years. And I say that without exaggeration. And I want to bring it home about why this is such an important issue for me by telling you guys a story about how I got involved with advocating for health reform. And this actually goes all the way back to 2009, shortly after I moved to Washington, D.C., and this was towards the end of October of that year. There was an interview on Fox News with Michelle Bachmann, Congresswoman Michelle Bachmann. And at the time, the Tea Party had a really heated summer, grilling members of Congress at town hall meetings. And despite all of that, the members of the House, at the time it was under Democrat control, Nancy Pelosi was the Speaker of the House, and they were moving forward with bills to work on health reform. And at the time, there were 3 committees that were working on it. They came up with a single bill at the beginning of October. That bill included a public option. And this infuriated people like then Congresswoman Michelle Bachmann and a lot of the Tea Party because, the public option was, to them, this incredible injustice. And so Fox News hosts this interview with Congresswoman Michelle Bachmann about, what can people do about all of this? And, she told the viewers of Fox News and the Tea Party to storm the halls of Congress days before the House was set to vote on the health reform bill that included a public option. Her instructions to the Tea Party people were storm the halls of Congress, tell these freshman Democrats that if they dare vote in favor of health reform, and that too health reform with a public option, that they were going to pay for it the following year, and that they really wanted to use these bullying tactics of a mob mentality to threaten the careers of especially freshman House Democrats. So on the other side of the fence, there were activists like myself, the National Physicians Alliance, a lot of members who were part of the coalition of Healthcare for America Now. We heard this threat, and we decided that we were going to respond in a very simple, peaceful, positive way to this Tea Party mob. And what we decided to do was that we got doctors together with members of the faith community, with members of the labor union movement, and with some other community organizers, and we broke up into small teams. And on the day of the Tea Party storm, this was November 4th, 2009, we decided that we were going to make sure to visit all of the House Democrats who were either a maybe on health reform or people who were in vulnerable districts where they actually did feel that there was a legitimate threat to losing their job. And we wanted to remind them that it's time to put patients before politics, that we were representing people who were too sick to be there themselves and to raise their own voice. And we were giving voice to the voiceless. And part of our strategy included showing a poster that a coalition of doctors had bought out in the local Washington, D.C. press. And the poster was a compilation of groups from the National Physicians Alliance, Doctors for America, but then also the professional associations, the American Medical Student Association, the American Academy of Pediatrics, the American Academy of Family Practitioners, the American College of Obstetrician and Gynecologists. I mean, these were all of the major doctors groups that you could think of. It's very difficult to get any of these groups to agree on anything, but they were willing to come together for the single ad that said, "We are 500,000 doctors who support health reform." And at the time, all of these organizations knew that that health reform bill included a public option, and they were willing to throw their support behind it. So our little groups of people, when we were visiting these House representatives, were taking this poster to show them that, no matter the mob that you might be hearing, down the halls and out on the lawn of the Hill, never mind them. You were hearing from 500,000 doctors from all of these organizations that health reform was going to be something that would be vital to the progress of American healthcare, that it was going to be so critical to saving lives. That October we learned that 45,000 Americans were losing their lives every year because they lacked health insurance. And we were taking this message to every House Democrat that we could. Over the course of that day, I still remember that, this was actually how I met people like Shauna Thomas and Tanine Allison, who have been guests on this show. I remember that we were in communication. Our groups were all in communication with each other. And one of the groups, asked for help because there was a mob outside of then Speaker Nancy Pelosi's office in the Cannon House office building. And so we rush over there, and these Tea Party activists have filled the hall, and you can hear them screaming, "Kill the bill, kill the bill, kill the bill." And I mean, they have got copies of the bill, Xeroxed, and you see shredded paper just flying all over this is a hall of Congress, and you just see shreds of paper in the air. You hear all of the screaming. You can barely hear yourself think or talk to the next person, in front of you. And it was a madhouse. And they see me in my, at the time I was wearing my white coat. I had the poster, and it was pretty clear that I was not on their side, that I was there to offer a very different message. And their first response to me when they see me is that, they question my legitimacy as a doctor. They ask me, "Are you even an American?" They question my legitimacy as an American because I'm brown, and they think that that's something that they can attack me with. They accuse me, they said that you got into medical school because of affirmative action. They see the poster and they think that it's absolute nonsense, that there's no way that the American Medical Association, the AAP, AAFP, and all these groups, there's no way that this many doctors agreed that health reform was a good idea. So they're trying to delegitimize myself and all of these people, but, they never had an alternative. They weren't there with an alternative idea about how to give their fellow Americans the basic human right of seeing a doctor when they needed one. There was nothing. They attacked the color of my skin. They attacked the content of the materials that we had, but they never had an alternative idea. And it really showed me that, at the end of the day, us as activists, we cared about people who could not be there themselves. The sick, the tired, the poor, people who were on the losing end of American healthcare. That's who we were for. And to this day, I still have no idea who the Tea Party activist people were representing, because it felt like they were there to just be anti-Obama, to be, loud, obnoxious, and to somehow just stand in the way of progress rather than actually contribute something meaningful. And, and one of the women who saw my poster and heard me speak, she, and this is on camera, and unfortunately the footage, I think, ended up on the cutting room floor because it's not the kind of thing that conservative media wants to have out there. But, she was asking me, "How can you be right with God when this bill kills babies?" Now, mind you, I'm a pediatrician, and the American Academy of Pediatrics was in favor of this health reform bill. 500,000 doctors were, belonging to dozens of organizations were behind this piece of legislation. There's no way that we were going to be in favor of anything that was as stupid or cruel as a law that would kill babies, that would be in favor of death panels and all this other nonsense. Like, that is not the way we were. But my response to this woman was that, I think that we let God down. When she's asking me, like, how can you be right with God when you're in favor of this legislation? My response is that, like, I don't think we can be right with God when we let 45,000 of our fellow Americans die because they don't have health insurance. That's not a failure of their biology. That's not a failure of their genetics. That's not a failure of their healthcare. That is a failure of us as a supposedly moral society when we, ignore 45,000 Americans dying every year from a lack of health insurance. And I remember that, this just infuriates them even more, right? Like, they get further up into my face, and they're like calling me, you're a communist, you're a baby killer, you're not even American. And I can feel, they're so close to my face that I can feel, like, that little bit of spit that sometimes, like, accidentally, like, leaves your mouth. I can feel that, like, on my face. And I'm realizing at that point that, like, that there is very little that they are representing besides their wrath and their anger and their hate. That they are not representing anybody who is, who has suffered at the hands of a broken American healthcare system. And I fast forward from that story to March 2010, and there was another group of doctors getting together March 22nd. We all got together at Freedom Plaza, and we decided that we were going to march for health reform from Freedom Plaza to Capitol Hill. And this was a group that was organized by the National Physicians Alliance, Doctors for America, the American Medical Student Association, the American Academy of Pediatrics was there. Like, a lot of, physician activists were there. It was pouring rain. I still remember this because we were all in our white coats, and by the time we got to the Hill, we were soaked. And, but we were undeterred. And it was great to actually hear the speeches that day because we were really just pumped about how much we had endured with health reform at this point, that a lot of us were just, invoking that the attitude and the spirit of Dr. Martin Luther King, who said, now is the time. Now is the time that we needed to repair the injustices of this broken American healthcare system. And the next day, the president signed the Affordable Care Act into law. Now, I'm telling you guys these stories not because I want any pity. I could care less about if you feel sorry for me after, you hear about, Tea Party people being in my face and being, bigoted. I'm not looking for your pity. And I'm also not looking for your praise either. That's not the reason why I'm telling you this story. I tell you this because actually what I really want is that I want the opposition to know that I am undeterred, that I can endure all of that and I'm willing to endure so much more because I believe in health justice. I believe in my patients. I believe that we can be a better society than the one that we have now. That I believe that when I started this journey of becoming a doctor and, practicing healthcare in this country, that I never took like a Hippocratic oath. Like, there was no part of the Hippocratic oath that said that I was going to, tolerate, injustices that were within my reach to do something. And I'm hardly alone in this. I'm hardly the only doctor who feels this way. And, the reason why I tell these stories is really more from the attitude of bring it on. We are there are thousands and thousands of doctors and healthcare providers and nurses and dentists and people who are willing to take on this kind of opposition because we have had it. We have, enough is enough. We feel that our patients deserve better. And the Affordable Care Act is that monument of progress that we are making. The journey is hardly over. The fight is hardly done. We're still here. We're still pushing for more. And we want to transform, our healthcare system into one that actually upholds human rights and social justice. That we feel that these are the ideals that we strove for when all of us applied for medical school and when all of us were working those 80-hour work weeks as residents. This is what we were, we wanted a system that worked with us, not against us. We wanted to be able to, send our patients out into a world that, built them up, that supported our work for them and that supported the patient's work. I mean, they endure so much just from being sick and from maintaining health is not an easy thing to do. Our society owes them better. The Affordable Care Act is part of that ongoing saga. It's part of that story that is still being told. It's still being fought for. And I feel that if we've spent 4 episodes talking about it, is because I feel that we haven't actually talked about that journey enough. That I feel that there are those 45,000 Americans who are dying every year because they lacked health insurance. We owe this to them. I dedicate these 4 episodes to them because they're not here to to be with us and for us to repair those wrongs that were done to them. I believe that the Affordable Care Act is some kind of prevention for making sure that type of injustice doesn't happen again. And as I've pointed out on previous episodes, there's still a lot of work to be done. And I believe in it. I believe in the work, and I'm here for you guys on this because, I feel that it's I'm willing to endure all of that kind of stuff. I mean, people calling me whatever names they want to call me, whatever rain, snow, heat, cold, whatever the heck it is. I'm willing to endure all of that because it's nothing compared to what my patients are going through, and it's nothing compared to the injustices that I see patients and families suffer day after day after day. So I'm proud to stand up for the Affordable Care Act. I'm proud to wear the shirt, I like Obamacare. And I'm really excited, actually, to introduce you guys to the next couple of activists that we're going to feature on this episode. We've got some people that we got to meet while we were at the Supreme Court. I know that we keep coming back to these interviews, but there were just so many great voices that we got to hear from that day, and I feel like all of them need their chance to, be part of the show and to contribute their wisdom and insights and inspiration. So to prove my point that I'm not the only doctor who feels this way, in this week's episode, we're going to be hearing from a couple of other doctor activists. You're going to be hearing from Dr. Alice Chen from Doctors for America. You're going to be hearing from Dr. Manisha Sharma. She's part of Doctors for America and the National Physicians Alliance. And you're going to be hearing from Dr. Arthur Lavin, also from Doctors for America and from the great state of Ohio. I am excited for you guys to hear their stories and to hear their passion and enthusiasm for the Affordable Care Act and what it means to them and what it means to their patients. And I hope that these episodes serve as not only information but inspiration, and that we can continue this journey of health justice together. So anyway, I'm going to hand over the storytelling to these interviews. They're coming up right now. You're listening to the Dr. America Show here on the We Act Radio Network.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
Welcome back, everybody. We are on the We Act Radio Network here at Families USA Radio Row. Today, the Supreme Court is hearing arguments about King versus Burwell, the latest threat to the Affordable Care Act. And with me right now, we have Dr. Alice Chen, Executive Director of Doctors for America. She is an internal medicine hospitalist at UCLA and assistant clinical professor at the David Geffen School of Medicine. She has done amazing work both here in the United States and worldwide, and we are thrilled to have her on the show today to tell us more about the Affordable Care Act, King versus Burwell, and where we are at as physicians and patients. Thank you so much for joining us today.
Thanks for having me.
Okay, so Alice, as we all know, the Affordable Care Act is going to be turning 5 years old. I can't believe it's already 5 years.
So hard to believe.
Yeah, at the end of this month. Mm-hmm. And so in the last 5 years, what would you consider the highlights to be both for patients and for physicians?
I'd say the biggest highlight, hands down, is the fact that people are getting health care who couldn't get it before. It is that patient who couldn't breathe, his legs were swollen, he had no idea he had heart failure, he didn't have health insurance, he couldn't see a doctor, got covered within 1 month. There he was in the hospital with me, feeling better, excited to live his life again. That is absolutely the highlight.
Awesome. And, I guess, I think that there's so many stories that are like that, happening across the country in every state. But here we are with King versus Burwell, and it's starting to seem to matter whether your state set up their own exchange or if the federal government is running their exchange. So what's at stake if the Supreme Court decides that they're going to side with the plaintiffs? If they say that, these tax subsidies, are not going to go towards, people who bought their health insurance through the federal exchange and only the state exchange, what does that mean for our patients?
That means that millions and millions of people will suddenly lose the tax credits that are allowing them to afford their health insurance. The estimate is that 8 million people will lose their health insurance because they can't afford it anymore.
Wow. So 8 million people are now going to have to face that false choice of their health or their wealth, but they can't have both.
Exactly.
Okay.
Exactly.
Now, are there any other parts of this law that are going to be threatened because of taking away the tax subsidies? What are the ripple effects that we're looking at?
I think not just the law, but if we take away the subsidies, we know what's going to happen. The sicker people who absolutely need health care will still stay in the system, will still try to be in there. Insurance will get more expensive for everybody. And what we're going to see is not only our premiums going to go up, which means more and more people get uninsured. We're back into the spiral we were in before. But also, the entire system has been rearranged to assume that people are going to get tax credits and get covered. We're going to see rural hospitals closing. We're going to see all kinds of effects across the system. We don't even know what they all are.
So, there's actually some pretty serious ripple effects that will come from a Supreme Court decision that sides with the plaintiffs on this one.
Exactly.
The decision comes out in June, but by the end of the year, we could be, looking at, a very, very different enrollment period where, a lot of folks who never thought about the federal exchange are going to be looking at their own premiums and realizing that, just like you were saying, we're kind of moving backwards, not forwards.
Exactly. And it's so frustrating to think that so many people finally got their health care. They're finally able to take care of things. Some people have just realized they have cancer. They just realized they have diabetes. They're finally getting the care they need. And we're just going to take it away from them? That's unbelievable.
Right. And it's really un-American. It's really just not it's not really consistent with, I think, the values of the kinds of people that we are, nor is it really consistent with the values of us as physicians where, we are not really accustomed to, telling a patient that here's your situation, here's your diagnosis, and good luck with that. We don't really end the conversation when our patients need us. So This is pretty serious. But let's, let's see the flip side of it. Let's say that the Supreme Court, sides with the federal government and rules that these tax subsidies are perfectly legal and that, our patients are allowed to, get them so that health insurance is affordable. What do you feel are what's next for those patients?
For those patients, they keep their care.
Right.
So keep going to your doctor when you need to, and get your primary care, and take care of yourself, and do all those good things to stay healthy. I think for the system as a whole and for the country, I think it's time to just move on.
Right.
People have gotten covered.
Right.
We have more problems to fix in
Right.
healthcare and education, in so many areas. Let's get together and work on those and stop relitigating the same
issues again and again. I hear you. So, when it comes to, how we can, actually, keep the Affordable Care Act strong, let's assume that the Supreme Court sees things our way. It looks like, it feels like the administration is very optimistic that the Supreme Court will rule in favor of the Affordable Care Act. What do you feel is maybe the next thing that the Affordable Care Act could work on as far as a room for improvement?
I think making sure that those people who have newly gotten covered can really access all of the care that they need. Primary care, specialist care, hospital care, that they can actually get to the people that they need. I think that's one important piece. And I think another piece is making sure that there's prevention in the Affordable Care Act, and making sure that people are, now that they have their health care, they're able to move forward and get themselves healthy.
Okay, so thank you so much for joining us today, Alice. I'm really, I'm really eager to hear what the Supreme Court decision is going to be in June.
Indeed.
It looks like we've got a couple of months to wait, but in the meantime, thank you for helping us celebrate what the law has done so far, and hopefully we can keep celebrating.
Sounds good. Thank you so much.
All right, thank you so much for joining us, guys. You're listening to the We Act Radio at Families USA Radio Row.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
Welcome back, everyone. You are listening to the We Act Radio Network here at Families USA's Radio Row. Today, the Supreme Court is hearing arguments about King versus Burwell. This is the latest threat to the Affordable Care Act and all the great work that it's done so far. So, to help us make more sense of this, I'm really thrilled, really excited to introduce a good friend of mine, Dr. Manisha Sharma. She is the Director of Leadership Cultivation with Doctors for America. Manisha and I go way back. We were, fighting for the ACA before it was an act and it was still a bill. So, Manisha, thank you so much for joining us on the program.
Thanks so much for having me, Sanjeev.
Okay, so as you know, Obamacare's got a 5th birthday coming up at the end of this month. I can't believe it's already been 5 years.
I know.
It's
Remember
crazy.
when we were out there rallying?
Yeah, that long march in the rain from Freedom Plaza to the Hill.
Right.
Yeah. So, when you look back at these last 5 years, what would you say have been the highlights of the Affordable Care Act for our patients and for our colleagues?
Wow, that's a great question. I think the highlights that I think of are the folks before the Affordable Care Act coming on now being healthier. I always think about one of my patients who was a 62-year-old woman who actually was too rich for Medicaid at the time, prior to the Affordable Care Act, and too young for Medicare. And she was too poor to be able to afford health insurance. And her job of taking care of children didn't have health insurance attached to it. And she was a diabetic. And a lot of folks don't realize when you're a diabetic how much insulin costs when you're uninsured, right? It's about $200 to $400 a month.
Yeah.
This is a woman who actually rationed her medicine, and actually because she wanted to choose between her medicine and actually paying her rent. That was pre-ACA.
Okay.
Post-ACA, this woman now comes and sees a doctor all the time. Okay. She's able to afford her medicine. She doesn't have to choose between her health and her rent.
Right.
And she's healthier. Her diabetes has actually gotten better. She's actually been able to control it. She's able to take care and control of her life. That's what I think of. I think of our patients and what that happened and how this helps them.
And I would say, like, that peace of mind right there is the thing that I've really appreciated about the Affordable Care Act, where we're, no longer trapping patients and families in these false choices
Absolutely.
of, your health or your finances. You can't have both. And so that kind of brings us to King versus Burwell.
Yeah.
And so like, how did we get here? Like, I mean, like, what's at stake right now?
To be honest with you, it's a surprise, right?
Mm-hmm.
Because I think what's at stake is people's lives are at stake, right? So if you think about what King versus Burwell is actually, what the oral argument is about basically taking away people's tax credit in 34 states of America that use the federal health exchange, right? And so what's at stake are the fact that these are folks that actually are working, the working poor,
Right.
working middle class,
Right.
who don't get their health insurance from their job. So they're able to get it from the federal exchange and get a subsidy for it. Just like if we were going to school, we get a subsidy for our
Right.
loans. So this is a credit for them to be able to get healthier. What's at stake is stripping that away, which means that those folks who are trying to get healthier now are going to have to get sicker if this doesn't go our way.
And so, and there's no backup plan, right?
No, zero backup plan. It's so easy to tear things down, but it's really hard to build things and make it better. And the folks that are the obstructionists against the ACA, you and I know,
Right.
they tried to repeal it 57 times. I just always wonder how much tax money was spent on that
Right.
to actually make that
Right.
happen. And there's no alternative. Our President Obama has told us, hey, give us a solution. There's never been a solution on the table.
And I think, like, that's actually kind of the sad thing about all of this is that, like, we're talking about 6 words in a 900-page, law. And if they really, really wanted to go back and fix this non-error, if they really wanted to go back and fix this non-error thing, it takes about 1 page.
Right.
To go back.
You can make it better.
Right.
Make it sound better. But these 6 words, the detriment that it could these are 6 words that are taken out of context of the law.
Right.
The intent of the law is clear. It has been clear. The ACA works. And there is also in the law that says those 6 words, there's other words in the law that actually say, correct those 6 words.
Right.
So I'm not, it's almost a silly argument to bring.
Right.
And it's sad. It's a sad situation that we have to be here today.
Absolutely. Well, I mean, I think that this is more about politics than it is about, like, legal philosophy or law.
Absolutely.
So, I kind of want to bring it back to, taking care of these patients who are, at risk, right? So Congress doesn't have a backup plan, which means that doctors have got to, and doctors, hospitals, clinics, we've got to come up with something. But you've taken care of, underserved populations. And, I mean, do you see our system being able to sustain, what's it, like 9 to 10 million people without health insurance all over again?
No, but that's the reason why we marched down, and being able to march and say, no, this is taxing our system. It's taxing us as providers. It's taxing our patients and their communities
Right.
and our livelihood, right? So this is gutting the ACA isn't a solution.
Absolutely. So let's look at a different picture. Let's say that because it sounds like the president is pretty optimistic that the Supreme Court is going to rule in favor of the ACA. So let's say that comes to pass. What would you say is like kind of our next challenge as advocates, as health policy wonks, as people who are trying to keep our patients and our public health at its best?
I think I agree with you, and I agree with our president. I actually do believe that our Supreme Court justices will fall in favor of the people of the United States. That's what we're here for. I do think we need to make the ACA better. I think there's so many things that we could actually make better. One of those things is the physician pipeline. How do we build good social justice doctors from the time of medical school? If not, I challenge even from pre-medical school. We need to foster that pipeline to actually have more primary care providers out there. We still have a dearth of primary care. So you, pediatrician, me, family medicine, our internal medicine brothers
Colleagues,
and sisters.
right.
Yeah. So I think that's one thing that we need to really look and focus. I think the second thing is we need to have us, the folks who do the work on the ground at the table and being able to improve that policy. Policy is only as good as the ground.
Absolutely.
And so we have to be there.
Absolutely. And when we're talking about, like looking at on the ground healthcare, improvements, one of the things that concerns me is when the prevention fund, keeps getting targeted whenever the budget talks come up. So, I mean, have you seen any problems with prevention just not being emphasized enough in your patient's care?
Yeah, I think it depends. So I'm now in the state of Maryland, which is a very specialist-driven state, and there's a dearth of primary care. I think there's a culture around primary care. What the ACA has been able to do for us is be able to put prevention and primary care to the forefront. I just think we need to push that more.
Absolutely.
But in a place like New York, where primary care is actually part of the system, there's a really collaborative culture that comes along there. So I think we as primary care doctors do need to be at the table. I think we need to also protect our graduate medical education funds, which is also at risk. And these are folks who are trying to cut, the same people are trying to cut the ACA, the same people are trying to cut our money to get educated.
Right. Now, so for our listeners, just to kind of remind you guys, graduate medical education, that's talking about how your doctors, your nurses, your dentists, your public health people, how they get educated about what's latest and greatest and safest for our patients. And Manisha, do you mind just giving us a quick overview of what's the threat there? What's happening with that?
I think the threat right now is we're actually going to be meeting Senator Merkley and talking about this today. But the threat right now is how does that money get distributed to actually do good training? And it's the shift of that cost is actually A, being cut, or B, actually shifting towards specialist care. And so I think what we want to do is make sure it gets focused into primary care, family medicine, pediatrics, internal medicine, and being able to be more transparent about how these training programs use that money to train us.
That sounds great because, I mean, as we both know, we get to see patients before they get so sick that they need the help of a specialist.
Exactly.
And so, we'd like to be able to offer our patients the best of what we can.
Right, exactly. And in a healthier state.
Right. One last thing I wanted to get your perspective on was about Medicaid expansion. Because, when I look at our health inequities, I think it's stunning to me that these governors are leaving so much, potential on the table. And, we've got 4 million of our fellow Americans who, are being left out in the cold for, because of these governors. So, where can we get involved next on that?
So we can get involved in the states that don't have Medicaid expansion. And ironically enough, a lot of those states are the ones that don't have a state exchange.
Oh, wow. So now they're going to be hit with the double whammy by Kingsbury v. Orwell.
Exactly. So I think, when you look at who those states are, there are southern states. These are some of the most impoverished states. And so what we can do as docs in white coats and scrubs and stethoscopes is get out there and lobby. Talk to those governors. Talk to your state representatives and really get your voice heard to explain why Medicaid expansion actually works. Let's not forget that the face of Medicaid is changing. And face of that is a college graduate. And let's not forget that. So that to me is really important for the future of our nation. And the future of our workforce.
Yep. So you guys heard it here first, because Medicaid is not just for those other people. There's a pretty good chance that you're one of the others too.
Exactly.
And if when you next time you talk to your doctor, your nurse, there's a pretty good chance that their work is not being made any easier by these governors. And like Dr. Sharma just told you, there's a great chance for those guys to get involved and let their governors know. Well, Manisha, thank you so much for joining me today.
So much
really
for
appreciated
having me.
this chat. All right. And so when we come back, guys, we're going to be talking more about King versus Burwell, the threats to the Affordable Care Act. Don't go nowhere. You've been listening to the We Act Radio Network. We are at Families USA's Radio Row, and we'll be right back.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
Welcome back, everybody. Here we are with the We Act Radio Network at Families USA's Radio Row. Today, the Supreme Court is here, continuing to hear arguments about the King versus Burwell case. This is the latest threat to the Affordable Care Act, and I'm really excited to talk about what's at stake with my next guest. This is Dr. Arthur Lavin. He's a pediatrician, just like me, so always fun to have another pediatrician in the house. He was trained at Harvard and MIT. He is a professor of pediatrics at Case Medical School in Cleveland, Ohio, and we're really excited to have him. He is the co-chair of Doctors for Healthcare Solutions, a group of 600 progressive doctors in the Cleveland area, and co-director of the Ohio Doctors for America. Dr. Lavin, thank you so much for joining us.
Well, thanks, Sanjay. Pleased to be here.
Okay, so, when we're looking at the Affordable Care Act turning 5 years old at the end of this month, and, when you look back at these last 5 years, what would you consider to be some of the highlights for, patients and for physicians?
Well, Sanjay, I'd say the big highlight is it took our country 100 years to get to this point. I still pinch myself in wonder that we've got 11 million people signed up who didn't have health insurance before. I hope your listeners can appreciate the fact that the United States is an unusual place for there being an equation between having health insurance being healthy. So not everywhere do you have to have health insurance to be healthy, but United States, if you don't have health insurance, you get sick, you can suffer death, you can suffer severe setbacks from illnesses that aren't treated. And it's the number one cause still for medical bankruptcies. So I'm thrilled that in the last 5 years, 11 million people have found some relief.
Yeah, so it sounds like there's definitely that peace of mind, because a lot of the consequences that you're talking about, these aren't necessarily because of medicine or biology failing us. This is our systems failing us.
Yes, absolutely. These are choices.
And so when we look, and the other side of healthcare is obviously the provider side. And so when we look at, how the ACA has been going for the last 5 years, what do you feel the benefits have been for, us as doctors or other kind of healthcare providers?
Well, as pediatricians, we've been very lucky. Relatively speaking, healthcare for children is pretty cheap. Mm-hmm. So even including the sickest premature baby, the average across the United States is somewhere between $700 per child per year, which is far less than the average amount of costs to care for an adult. As a result, most children in the United States have been insured over the past. The great bulk of the uninsured have been working adults. But children with extremely complex health diseases have had a lot of relief from Obamacare. And we know from stories that are nationally known, people with congenital heart disease and other complex situations, having the surety that they won't be booted off their insurance plan when they develop these complex disorders has completely changed the landscape for children across the country. And that's had a big impact in my view of medical practice in the United States. And,
I'm glad that you're bringing this up because, as a pediatrician, even, when I look at my own training, when I look at what I was taught in medical school about, the odds of a child with leukemia surviving, and then by the time I got done with training, it wasn't really so much, we weren't talking about just surviving. We were talking about, well, what are the, health outcomes as you approach adulthood, as you approach, middle age. And, I find it striking that, we've done so well on the science side, but when it comes to helping, these young people actually become full-blown adults, it's this health insurance question that is really the challenge.
It's a funny thing. I was just at a rally in front of the Supreme Court, hoping to convince at least one more judge to vote in favor of keeping this going. There is no rally in front of the Supreme Court to argue about whether someone with leukemia should get chemotherapy, or better yet, there's no rally in front of the Supreme Court with sides taking sides about whether science should come up with a cure for cancer or whether we should come up with a way to get rid of all allergies. There's unanimity across the whole United States. Everyone wants a cure. I feel that way. I'm excited about the advances that science brings. But isn't it a funny thing that when it comes time to bring those cures to people, all of a sudden becomes controversial?
Right.
Now when we have decisions to make, should everyone in the United States who have cancer get the cure that exists. Now, all of a sudden, people are taking sides in front of the Supreme Court. I find that very peculiar, and I'm looking forward to the day when the idea that everyone not only supports the idea of scientists finding a cure for depression or cancer, what have you, but are similarly united in the idea that everyone should have access to that cure.
Absolutely, and I really am hoping for that day too. And so the rally that you participated in with the Supreme Court was for King versus Burwell,
yes,
and to tell these justices to not take away the care of somewhere between 9 and 10 million people.
Mm-hmm.
And so so let's say the Supreme Court rules in favor of these plaintiffs, and those tax subsidies that were going to the federal exchanges stop going to those exchanges. What kind of outcomes are we talking about for patients?
Well, King versus Burwell is a very arcane, legalistic argument. And there's exchanges and wording and IRS agencies. I mean, there's a lot of stuff that's very confusing involved. But I'd like your listeners to know, from a physician's point of view, it's very simple. If one judge makes it a 5-judge majority finding in favor of King and other plaintiffs, 8 million people could stand to lose their insurance. Now, a lot of people say, well, sometimes I have insurance, sometimes I don't. Maybe that doesn't matter. But we're talking about health insurance. Mm-hmm. And the estimate from nonpartisan sources is 10,000 people lose their life every year just because this law got overturned. 10,000 people, that's more than the number of Americans who died in Iraq and Afghanistan altogether.
Wow.
And that's how many would die every year because of a decision we took as a country. So that's why I stood on the steps of the Supreme Court today, because as a doctor, I couldn't sleep at night knowing that I hadn't done all I could to save 10,000 lives a year. It's a big deal.
It's a very big deal, and I'm glad that you were there, raising your voice for, especially for many of our patients who, can't be at places like the Supreme Court.
Mm-hmm.
They're too sick, too tired, too poor, too hardworking, to be, in front of the justices. And I'm grateful for your advocacy.
Thank you.
But let's look at another outcome that could happen with the Supreme Court, and let's say that the justices decide to uphold the law, and that the tax subsidies keep coming to the recipients of the Affordable Care Act. What do you feel are kind of the next challenges that we are facing as advocates? Because it seems like there's a lot. We've got like Medicaid expansion, we've got immigrants. Like these are I think like the challenging areas of bringing people under the umbrella of healthcare. But from your vantage point, like what do you feel is like kind of the next big challenge?
Well, the Affordable Care Act was really a step towards making sure that you won't die if you're an American because you don't have insurance. Mm-hmm. That's how it used to be for about 100 years. I mean, it's Teddy Roosevelt down through FDR, Truman, Nixon, if you remember Nixon, Clinton, all tried to do this, all failed. And so this is the first step. There are 42 million people without insurance in America. Now 11 of them are covered. So the next step is to take care of the rest of them. Obamacare is in a position to do that. Very excited about the prospects.
All right. Well, okay, Dr. Lavin, thank you so much for joining us today. I really, really appreciate hearing your perspectives and your advocacy. Thank you so much. And everybody who's been listening to the We Act Radio Network, we are here at Families USA on Radio Row. Thank you so much for joining us, and we'll be right back.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
Welcome back to Dr. America. I am your host, Dr. Sanjeev Sriram, here on the We Act Radio Network. Thanks for staying tuned with us. So for the next segment of the show, I'm actually excited to introduce to you guys some activists who come from a very overlooked but should never be forgotten community, and that is the members of the faith community. I was inspired by the people that I got to meet from various churches, synagogues, mosques, and in temples, and people who were just doing amazing work back in 2009 to sort of give the Affordable Care Act, when it was still kind of just a bill. They gave that legislation its moral compass, and I think that they have been such an important voice. Members of the faith community have been such an important voice in giving a sense of morality to the work that is extending health insurance coverage to our fellow Americans. It was such a privilege and an honor to get to meet them, to work with them, to be activists side by side with them, and it was really a pleasure to get reacquainted with them over at the Supreme Court during the King versus Burwell hearings. And I'm excited to share these interviews with you guys because, to me, the members of the faith community don't get enough credit in the success story that is the Affordable Care Act. They were there when before the act was an act. It was still pieces of legislation, but they've actually been so important to doing the work of the Affordable Care Act, doing the work of Obamacare, where members of the church have actually, encouraged their congregations to be volunteers, to help people sign up for health insurance. Many of them have actually encouraged, church leaders and, local leaders of the church community to, learn more about the Affordable Care Act, so that when their parishioners and members of their congregation were coming to them, describing their health concerns, describing their worries about losing health insurance, that they would be able to actually give them accurate information and point them to resources that would actually help them out. And this was, it's an amazing, amazing story that gets very much overlooked because so many leaders of, our churches and our synagogues and our mosques have, done the hard work of learning what the Affordable Care Act is. How do the health exchanges work? Who do you contact? Who do you call? I've been pleasantly surprised and amazed by the people working at the community level, helping the members of their congregations get healthcare coverage. Without further ado, I'm going to go ahead and introduce you guys to them. You're listening to the We Act Radio Network. I am your host, Dr. Sanjeev Sriram, for the Dr. America Show.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
Welcome back, everybody. You are with the We Act Radio Network here at Families USA Radio Row. Today, the Supreme Court is hearing arguments about King versus Burwell. It's the latest threat to Obamacare. And I'm very excited to introduce you guys to our next guest, Reverend Cynthia Abrams. She is the Director of Healthcare and Wholeness for the General Board of Church and Society at the United Methodist Church. Reverend Abrams and I actually go back personally when we were fellow advocates advocates for the Affordable Care Act back in 2009 and 10. And so it's really great. I'm really excited to reconnect. And so, Reverend, since, the Affordable Care Act was enacted in 2010, all those years ago, what have you seen from your perspective as like some of the benefits to our fellow Americans?
Well, I think much of what we've seen is that people are getting health care for the first time, or they're getting better health care because before they were underinsured or not insured. And in addition, we're seeing, our parishioners and those that come to the church looking for help, there's an alternative for them. We've educated our pastors and our faith leaders in our local communities about how they might connect so people can be enrolled or enrolled in other programs if they're eligible. So there's an option now instead of having to deal with each individual issue and try and come up with money or try to figure out a way to deal with this one crisis that might be happening in a family. So it's taken it away from crisis management and made it more an integral part of how we care for our community, which we think is very important because we say that healthcare is a basic human right.
Right. Yeah. And it sounds like, it's so, inspiring to hear that the faith community has been part of like the solution finding process for, these families, where before, just like you were saying, they were, kind of like in crisis mode. What has been your, what would you say like the faith community's experiences have been in terms of, for their own personal, I guess, journeys, of connecting people with healthcare? What was it like before, and what is it like now?
Well, I can probably only speak to the United Methodist experience. I've heard stories from other faith communities what's happening. Each one is very individual and specialized about how they deal with healthcare. But the United Methodist Church, what it's done is we've had health insurance in the United Methodist Church for our clergy and our lay people who are employed by the church. But our churches, especially our smaller churches, even our medium churches, have struggled to pay for the rising cost. It's been a struggle for them. So one of the things it's done is slow the cost, the rising costs, and then secondly, because our clergy are self-employed, one of the things they've been able to do in some annual conferences is to help those clergy be a part of the exchange and be in that healthier risk pool. Because unfortunately, surprisingly, clergy have been sicker than the general population, so they're higher risk pool. And so when we purchase health insurance on the market, it costs more. And so now that we're in the general pool with healthier people, it's helped our costs to go down for those annual conferences, our regional bodies, in purchasing health insurance for clergy. So from an internal point of view, it's been positive. I think the challenge for us is sometimes you hear the argument in the faith community in general, that the faith community ought to be taking care of this problem, that we ought to be providing the charity to help people have health care coverage. And that is basically not based in reality, a practical approach, because if we struggle to pay for our own health insurance for our employees, how are we expected then to adopt the health insurance coverage or health coverage for all the people in our community? It's not really based in reality. And so for us, this is a practical approach.
Sure.
And it also mirrors what we in the United Methodist Church and in Christian faith say is mirroring Jesus' ministry. Jesus lending a hand and Jesus' ministry to the least of these. So those people that are most at the margins in our society are particularly helped by this.
Right. So, it sounds that, both the parishioners and the clergy are having this common journey towards, having better health and having more affordable health care.
Right.
And so that kind of brings us to, King versus Burwell, because, that affordability part is what's at stake with this particular Supreme Court case. So, how do you see the threat to affordable health care in this case?
Well, obviously, it's a significant threat. I mean, my goodness, if subsidies go away in the states that have federal exchanges, that's a huge blow to a low-income family or a family with very modest means. I can't imagine how they would be able to afford a premium. In fact, I know they wouldn't be able to. I've lived that myself, you know. When I was in college, I wasn't insured. I mean, the Affordable Care Act now covers young people up to the age of 26,
Right.
which is awesome.
Right.
But when I was in college, I, thought I was immune to being sick.
Right.
And I got acute appendicitis, and I had to go to the hospital and have an emergency appendectomy. Well, I had no health insurance. So I went to a free clinic. The free clinic sent me to a public hospital, and I waited in a waiting room for over 8 hours to get my appendix removed. And I remember feeling very stressed about, and at a loss at that point, about how to navigate the health system and be able to afford this. Thank God for Medicaid in California and Medi-Cal, which is what I applied for at the time, and they covered my surgery and everything. But had we not had that safety net, as well as the subsidy safety net today, I can't imagine how people of modest means, including college students who might have a sudden illness, be able to afford to have health care. We go back to the process where people go to the hospital only when it becomes an emergency, when it's very expensive, and taxpayers end up paying for that anyway.
Right.
So it's not good stewardship for us as a society either.
Right. So, I mean, it sounds like, one of the parts of your story that really kind of struck me was that, you were concerned more about your financial situation than your immediate health needs. I mean, here you are dealing with, the pain of, appendicitis, but it sounds like, what was, running through your mind almost concurrently was, how are you going to deal with it, financially speaking? It feels like that story is going to be, replicated any number of ways if the Supreme Court rules in favor of the plaintiffs.
I can't imagine for people who've gotten health insurance for the first time to have it suddenly taken away. In a way, they've probably budgeted their life and their household around having this insurance. So to suddenly have it taken away, the kind of havoc it would create for a budget and the kind of financial stress on a family, and I can't imagine what it might do to relationships,
right,
given the stress they might have of finances. That to me is really, would be really regrettable. And of course, clergy would end up picking the pieces up in some ways for some of these families, because when they have problems like that, one of the places they turn is to their faith leader, their clergy member, to help sort out the issue. And if the faith leader doesn't have an answer, then what?
Right. And I think, this kind of, kind of links back to what you were talking about before, that there's only so much that, that the church community, that the clergy leadership can do, because charity care is living in the real world, and that,
That's right.
there are some, real constraints there.
Right.
So, I've heard the numbers of about, anywhere from, 8 million to 10 million people who could have their insurance lost if the Supreme Court, decides that these tax subsidies cannot go to the federal exchange anymore. From your perspective, having interacted more with the faith leadership, are they do they have a backup plan, or do they feel that charity is ready to pick up the pieces, or are we really?
I don't think that we're ready. What struck me when you just gave that number was 8 to 9 million. That's the number of members in the United Methodist Church in the United States.
Total.
It's 8.1 million members. So that would mean to put it in perspective, the entire membership of the United Methodist Church would lose health insurance.
Wow.
That's the same number. No, we're not ready. I can't imagine what we will do. It's really going to be very, very chaotic and like I said, regrettable. And I think for those of us that have worked a long time to cover more people with health care, it'll be a real blow. And I hope it doesn't happen.
Yeah.
I hope that the Supreme Court look at the larger picture and see that the subsidies are indeed necessary, and that it's pretty clear what the Congress's intent was when they wrote that piece into the bill, that was to cover all the exchanges.
Right.
That's my hope.
That's my hope too, Reverend Abrams. Thank you so much for joining us today. I really
Thank you.
hope that the Supreme Court decides to keep the affordable part of the Affordable Care Act intact. And we'll be back with more. This is the We Act Radio Network. We're at Families USA on Radio Row. Thank you very much for joining us. We'll be right back.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
Welcome back to the Dr. America Show. I am your host, Dr. Sanjeev Sriram, here on the We Act Radio Network. I want to thank you guys for staying in tune with us this episode to celebrate the Affordable Care Act, Obamacare, and it's the great work that it has done for our fellow Americans. As we look ahead for the next couple of episodes, I'm excited to share with you guys that we're going to be focusing on poverty here on the Dr. America Show. We're going to be approaching it from different angles. We're going to be talking to people who should be doing something about it. We're going to be talking to people who are enduring it and overcoming it. And we're going to be talking to people who are going to give us some ideas about what we can do as Americans to help out our struggling fellow citizens. So I'm really excited about these next couple of episodes. You guys definitely don't want to miss them. Come on back and and be inspired, be informed, and share. And so thank you so much for joining us this week. Look forward to seeing you again soon. This is the Dr. America Show. I'm your host, Dr. Sanjeev Sriram, here on the We Act Radio Network. Thanks so much for joining us. Until next time, guys. Bye-bye.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.